I would like to get your opinion and some advice about an eye disease called Keratorkonus. It's a degenerative disorder of the eye in which structural changes within the cornea cause it to thin and change to a more, how do you pronounce that, rounded shape than the more normal gradual curve. It's destroying my life because I can't no more fit lenses, and it's dangerous for me to get a corneal transplant. Oh yeah, definitely, big time. Okay, so think about this. What side of chemistry, I think you always should go to this sort of thing. What side of chemistry that people are in most of the time that causes mutation of tissue? Acids. So that means your lymphatic system in your head area is not, you're not draining properly. Either you're sitting on top of chronic bowels, your kidneys aren't filtering, but you've got to fix this. Because it just won't be the cornea. You're talking about all the other eyes, parts of the eye, the retinas and all this. Now there's wrinkled retinas, there's all kinds of stuff from what acids are doing to tissue. And the inability of the body to fight that. And you put that together with like a parathyroid weakness where you can't utilize calcium properly, and you're going to lose structure, you're going to lose the coloration, the white of the viscous, you're going to lose all kinds of stuff. I would do the eye wash, that's for sure, twice a day, morning and night. I'd probably get, I've got some, it's called Visioplex. It's a complex of, it's got some vitamins in there, some vitamins, bilberry big time, raw eye tissue. Might give you a little help, but the big issue is detox your head area. Get your sinuses draining, get everything moving. That means you've got to clean down below here. You got to get your kidneys filtering, you got to go in the GI tract, get that moving and cleaned properly, and get your body cleaned up. Because this can be some serious stuff, you know, and then you've got the optic nerve and all that. So, yeah, I'd be really careful with that. But remember, most of these conditions of all types are in the presence of acidosis. You know, what's interesting is, and we could say simplistically, that you can put this whole mirage of diseases and problems almost rested on the laurels of acidosis. My eye's called Keratokonus, which, whatever they call that, which damaging the cornea and cause it to become thinner and weaker, which causing deformation. All right, let's stop right here while we just was talking about it. Now, what is your eye tissue made of? Particularly the cornea. Cells, right? Everything is cells and fluids, correct? All right. So now, you've got the cells and the fluids, the two fluids, blood and lymph, 20% blood, 80% lymph, flow around all the cells, even in the eye tissue. Okay? Now, the blood, that's all base chemistry. It cannot become obstructive, or there's death on the other side of that. Ischemic changes is when you see, ischemia is when you see blood being withheld to tissue. Pain comes in and then death comes in. It's like a heart attack or a stroke. However, the wastes and byproducts that are created by the burning of this chemistry and the activity of the body are acids. So, does it make just common sense at all? If you're just knowing that, does it make sense if the blood has to be alkaline and the waste and byproducts of life are acidic, that the blood would be responsible? You throw these acids back in the blood and the blood that, no, that there's no difference in that thinking as it is in pooping in your kitchen. I'm just going to go to the kitchen and use the bathroom. What's the difference? That's how stupid that is. So, in the eyes is no different in the brain, in the heart, the liver, and anywhere else. You got a bunch of cells with two fluids flowing interstitially or around it. In other words, every cell in your body is bathed in 20% blood and 80% lymph, basically. So, learning that. So, what makes things break down? What makes things thinner? What makes things tear apart? Acids. Not your bloodstream. Acids. You can't blame anything on this situation you have but your lymphatic system. There's no other system to blame. You could say that the cells in these tissues are genetically weakened. Absolutely could. But what makes them weak in the first place and what tears them down? Acids. So you're looking at, let's see what else, with deformation and can't get good vision with glasses or contact lenses and waiting for corneal transplant. In my left eye, well, you want to start rebuilding. I would do the eye wash internally. You might get away with about 3 or 4 drops topically. That'll start inspiring. And if you can, move up a little more to 6 to 12 drops, but that'll inspire blood and lymph flow. You want to start inspiring blood flow through tissues here. The other thing, though, is you got to get on a raw diet, because when you inspire blood flow, you want the blood to bring the right chemistry to that area. With that said, there's a formula in here called Visioplex. It's got some things I don't like in it, but and vitamins and minerals. But it's got raw eye tissue, bilberry. It's got other great things in it that I do like. And you might want to get yourself some raw eye tissue as well to start inspiring new tissue growth and repair. At the same time, I'm going to inspire new blood and lymph flow through the eye tissues. And that's topically. And internally the same way with also upper circuit brain and nerve. Brain and nerve for that, right? Upper circuit brain. I'm going aggressively after this, right? But I'm going after that system. I got to get the sinuses drained out of here because they're coming down on you. I've got to get the ears pulled clean. I've got to get these bowels clean so everything can drain. I got to do that. I got to get the kidneys filtering. See the steps we have to do to get up here. But you got to do it because there's no magic. You just wave a wand and suddenly all that acid is gone out of tissue. I wish.
No!
Not going to happen. But can you repair and fix this?
Well, yes.
And having a corneal transplant does not fix this problem. And you're at odds at setting up for losing the new one. Now, that brings us to another thought here. What thought did you guys, can you read my mind? I know some of you can. You're right. Parathyroid. You're good. Parathyroid. We want to strengthen connective tissue, right? So we want to strengthen structure as well. So I would be thinking about, since this is all up here, I'm going to conjecture that you probably have a pituitary issue and a thyroid parathyroid issue going with all this. So I would do a pituitary herbal and a parathyroid glandular and start bringing strength to the connective tissue to pull form back in. At the same time, I'm moving the acids out that's stripping that and breaking down the connective tissue and forming lipid, whatever type of growth you're forming there. And all the mucus and all that. Blurriness, absolutely.